So it's day 20 of Ellen's keynote study streak, and we have two interesting remedies to take up today from what we are discussing in this last week, and somewhere they are related to the remedies that we have discussed. So let's take up Staph agria. The first line that is written in Allen's keynotes says that there is ailments from thwarted pride, envy or chagrin. For the bad effects of onanism, sexual excesses, loss of vital fluids, chagrin, mortification, unmerited insults, indignation with vexation or reserved displeasure. And in bracket we have the remedy or a metallicum. So there is a wide range of action of Staph agria on issues related to excess of what is not to be done, number one. Secondly, something that is related to insult by one person to the other, and then holding on to that insult and thinking over it. So it's like the remedy which we read, Ignatia, but in a more deeper sense. Over here in Staph agria, it will affect the physical body too much. In the Ignatia, it will affect the nervous system, but it will affect in a different plane. Over here in Staph agria, it will affect in a different plane. We will see this in some time. Then we have, for the mental effects of onanism and sexual excesses, the same line which is repeated. Very sensitive to slightest mental impressions, least action or harmless word offense. And you see the remedy in the bracket which is mentioned, Ignatia. So these are very close expressions which the patient will give you, and we'll have to pick up some thing from the physical body. It can be physical particular, it can be physical general, or it will be something that was the first symptom that appeared after the incident happened. What happens in Staph agria after the very first incident of insult? What happens in Staph agria? I'll come to that in a few minutes. But you have to understand, there will be different points where you will be able to pick up Ignatia, and there will be different points where you will be picking up Staph agria. So give me a minute. That is. Okay. So yeah, so you will need to pick up Staph and Ignatia from different points in the patient history. It can be the first symptom that has happened after causation. It can be something on the physical particular or physical general symptom, right? Let's see further. Great indignation about things done by others or by himself. Grieves over consequences. So in Ignatia, we'll have someone who is just focusing and thinking about something all the time without worrying what will happen next. Whereas in Staph, there will be someone who will think what will happen in future. So you see, this is something like natrum mur. In natrum mur, there is something which is very, very strong, singularly present, absorbed, buried as to what he would become. In Staph, there is an element of egotism which is hurt. There is a feeling that he had a high esteem, he had a high honor which is broken down, and he is laid back to his previous personality, or even lower than that, which is where the Staph state emerges. Apathetic, indifferent, cry for different things which apathetic, indifferent, low spirited, weak memory from sexual abuses. The other remedies being anacardium, aurum, natrum, and phosphoric acid. Then we have the symptom which is for children, which is ill-humored children cry for things which after receiving are petulantly pushed or thrown away, like the remedy creosote. Now interestingly, creosote is mentioned here. So there is an element of capriciousness uh, which we will see in many children, and especially in teenagers who will probably throw things away, or who will there is a very 3 mark remedy. Staphylococcus aureus is 3 marks in many places in different repertories for anger throws things. So you can see this small word which is mentioned, petulantly push or throw away. So it means that he throws it with an emotion, with something that is coming out as a frustration, and not just throwing it as a object to be thrown, but something that is thrown because his opinions or emotions are not accepted. So this is the symptom in children that we'll see. Now the next symptom is the crux of Staphylococcus aureus. If you want to understand Staphylococcus aureus in your clinics, this is what you need to understand from the patient history. And what the symptom is: was insulted, being too dignified to fight, subdued his wrath, went home sick, trembling and exhausted. So there is a very beautiful paragraph in Kent's lectures on materia medica, and it goes something like, an old man or some gentleman is below a bridge near a river or something, like he gives a description, and he is insulted by someone else and he is not able to speak. He goes home without speaking, thinks over it, feels bad, and there is constantly this thought in his mind about why that person shouted at him, why that incident happened, and he feels bad about it. So this is what is actually the state of Staphylococcus aureus. Whenever an altercation has happened, some fight has happened, he does not have the guts to reply, or he does not get a chance to reply, and he swallows his pride. Okay, and he goes home, and the problem starts from that point where the insult has happened. So there is a very, very, very beautiful observation, and I want you all to see in your next Staphylococcus aureus case. This thing that I did right now, I'll be sharing about my symptoms, and in the painful areas of my case taking, I'll be doing this. In Kent repertory and in major repertories, you will have this symptom in the form of rubric, where it says that patient swallows saliva when he is angry or excited, etc. Okay, so you have someone who is feeling very bad and he cannot express himself, and so much is his suppression that even his saliva he is not bringing out, but he is swallowing it up. Are you getting me? Those who are, I think there are a few people on both the channels we have, YouTube and Instagram. Are you with me? Are you understanding what I am sharing about Staphylococcus aureus and this peculiar symptom? You will see this in 99% of Staphylococcus aureus cases. The patient, while narrating his painful history, will be swallowing saliva. This is the level of suppression of Staphylococcus aureus. He feels so bad about that incident that he cannot even speak about it, or even when he tries to speak about it, he will swallow his saliva as if he is swallowing the entire incident or something, the feelings that happened with it. Are you understanding, Dr. Aditya, Dr. Pavi Breeze, Dr. Minita Fernando, Dr. Aniket Shinde? I don't know if you all are there or not there, but those who are there, they can just give me a reply so that I understand you all are understanding. Yes, Dr. Purvi is there. So this is the level of symptom which will show you the connection of the mind and the body. Even patients will drink water when they want to share about their mind history, and they get, the throat becomes dry or they develop cough. So those areas where you see when they are sharing their mind history, and you will see that they have physical symptoms, those you mark them, ask about them, and those are the bullseye where you need to hit and get the rubrics or get the symptom from the materia medica. Okay, so you have someone who is suppressed, goes home, is unable to speak, goes home, gets sick on the way, while going on the way, and gets trembling and exhausted feeling. Exactly opposite, we'll have the remedy Nux vomica. So Nux vomica is someone who will fight, who will rebel, who will retaliate, who will show his anger at that moment, exactly at that moment. There are many other remedies, but here he has mentioned only Nux vomica. Then we have mechanical injuries from sharp cutting instruments, post surgical operations, stinging, smarting pains like the cutting of a knife. So the patients who have been operated for gastric operations, it can be gallbladder, it can be appendicitis, it can be hysterectomy, or those organs that involve the soft parts of the body, that will require Staphysaria. Those patients will require Staphysaria because the nerve endings have been severed, and the connections have been disrupted, and those areas become very sensitive, and probably they cannot regenerate. So the best phase to give the Staphysaria remedy will be immediately after the operation. It can be in high potency, maybe 4 to 5 doses for 1 or 2 days. So it is like a smarting, burning pain like knife. Then we have the symptom nervous weakness, as if done up after much hard work, craving for tobacco, and extreme hunger even when the stomach is full of food. So if you have been seeing patients, or if you will see patients who have psychiatric ailments, you will see that they have an element of hunger, or element of food with their psychiatric symptoms. Either they will have lot of hunger, lot of desire for food, or emptiness feeling, or weak feeling in the abdomen, some weak sensations, or you will see that there will be complete absence or complete desire for hunger. And this is why we see that the stomach, the hunger, the clearing of the bowels, and sleep are connected to majority of the psychiatric ailments. Then we have the symptom sleepy all day, awake all night, body aches all over. So you will probably have some patients whom you will get them investigated for vitamin D, vitamin B12, everything is normal, but there is this pain which is not going. I can feel the pain and I don't know what to do. That is where you should think of one of the remedies being staph. Then we have sensation as of a round ball in the forehead, sitting firmly there even while shaking the head. So vague symptom. Staphysagria, like pulsatilla, is a good remedy for sty, chalazion on the eyelids, especially the upper eyelids. Like we have in hepar sulf in graphitis, that one eruption follows the other, we have in staphysagria one sty follows the other, and they leave hard nodosities when they appear. Another two remedies which we can think of is conime and thuja. Whenever you will have someone who is having recurrent styes, suppose the patient comes to you and tells that he is having styes in the last 4-5 days, just try to examine whether they keep having styes on and off frequently, so that you can investigate whether the patient needs staphysagria. And also you should correlate the physical disease with the mental history. You should probably ask also about what is their state of anger, what is their how is their behavior. In short, whatever you can get, how are you as a person in general. And they will say, I react very fast. And then you can probe further and ask, give me examples. So once you ask for examples about what they expressed, they will give you it in elaborate fashion, and then you will have some mind history, and then you will get some traces of staphysagria, you will get traces of pulsatilla or some other remedy. Toothache during menses, sound as well as decayed teeth painful to touch of food or drink, but not from biting or chewing, which we saw in Ignatia. Aggravated by drawing cold air into the mouth, aggravated from cold drinks and eating. Teeth turn black, show dark streaks through them, cannot be kept clean, decay on the edges. If they decay at the roots, the remedies are Miserium and Thuja. If they decay on the edges, on the top, on the edges, think of staphysagria. Cough only in the daytime or only after dinner. Worse after eating meat, after vexation or indignation. Excited by cleaning the teeth. Croupy cough in winter, alternating with sciatica in summer. Cough excited by tobacco smoke. So you see the extreme opposite symptom, where somewhere it was mentioned that there is craving for tobacco, but diametrically opposite we see that there is cough which is excited by smoking tobacco or fumes of tobacco smoke, like the remedy spongia. So there are some people or some patients who will come to you. They will be passive smokers. Someone in the home is smoking, someone in their friends is smoking. Think of asking them when is the cough more or what aggravates it. They will tell you about the smoke. You will very clearly get to the remedy, which is staphysagria. I have one interesting case which is who has developed heart disease, and she was a lady who used to sit at her family business with her husband to support her, and this was the only area I found which aggravated her heart problem, which is the fumes of tobacco from the neighboring tea shop where people used to come for tea and also used to smoke. I have given a lycopus also with the other treatment which I have given. So let's see if it's going to help in the long run whenever we get her investigated. Then we have the symptom in staphysagria from the Allen's keynotes. Sensation as if stomach and abdomen were hanging down relaxed, which is there in Agaricus, ipecac and tabacum. Colic after lithotomy or ovariectomy. attending abdominal section. So those patients who keep on having recurring abdomen pain after some operation is done, they will need staphysagria. Other remedies mentioned are bismuth and heparsol. Urging to urinate has to sit in the urinal for hours in young married women after coition, after difficult labor. The remedy, another remedy being opium. Burning in the urethra when not urinating, urging and pain after urinating in prostatic troubles of old men, prolapse of bladder. So it's very self-explanatory, but to give you a brief outlet, that if some mucous membrane or some part is irritated again and again, it can be the nerve endings in the abdomen while operating, it can be the urinary parts due to coition. Staphysagria is one of the best remedy in those cases. And there is a tenesmus which is similar to Merck core. Merck core is a good remedy for urinary tenesmus and rectal tenesmus. So tenesmus, how will the patient express this symptom of tenesmus? They will tell you that I need to go frequently to pass the urine, or if I go to pass urine, I will strain a lot, and I feel there is something coming, but I still cannot bring it out, and I feel that the sensation is still there. So that is tenesmus, to give you a summary. Then we have the symptom in staphysagria: backache aggravated at night in bed and in the morning before rising. So there will be many remedies who will give you this symptom. Staph is one of the top remedies because there is marked aggravation when they rise in the morning. You see the aggravation from coughing also, of coughing when they brush their teeth. Then there is a beautiful symptom, and I was talking about it yesterday, that you can go from the physical symptom to the mind of the patient. How will you go? So in staphysagria, in Allen's keynotes, we have arthritic nodosities of the joints, especially of the fingers, inflammation of the phalanges with sweating and suppuration. Now imagine if in your case, in your clinic, you have a patient who is having joint pains, especially the small joints, and there is nothing much she is sharing about in her mind history, in her physical generals, but we know that there is localization of the pathology in one part. So you should start thinking of the remedies which will cause this effect of localization of illness in one part. It can be Kali bichromicum, it can be ignatia, it can be staphysagria, it can be those remedies that have action on single spots or in just one organ. The entire disease is focused in that part. From here you can explore the remedies which belong to this sensitive nature or the mineral aspect or plants aspect, etc., and then you will be able to reach to the remedy. It requires more explanation, but it is outside this session, so maybe you can stay tuned and you can get to know. By the way, we undertook a webinar on kingdom differentiation workshop, and it was on plants, minerals and animals, how you can differentiate, how you can see in your clinic different patients, different versions, and how will you analyze, whether from the physical aspect, whether from the mind aspect, whether from the delusions aspect. And it was very well received. Me and my wife, Dr. Anshu, we have both conducted it in the month of April, and the recordings are available, those who wish to see them. So then we have in Staph, from the Allen's keynotes, painful sensitiveness of sexual organs. Vulva so sensitive can scarcely wear a napkin. The other remedy being platina, which has extreme sensitiveness. In males, there is onanism, persistent dwelling on sexual subjects, constantly thinking of sexual pleasures. Spermatoria with sunken features, guilty, abashed look, emission followed by backache, weakness, prostration, relaxation, or atrophy of sexual organs. So there are these teenagers and adolescents who will land up in your clinic and they will have a look which they will not meet eye to eye with the physician. They will probably look below, they will probably look elsewhere, but they will not meet you in the eye because they have this guilt that they have done something wrong, and they don't have to, you know, they don't have the guts to face anyone. From this observation itself, you will be able to catch staphysagria, or at least you can catch the expression of the patient, which is guilt, remorse. Probe about the different remedies of remorse, or the top remedies, the top 3 and 4 mark remedies, and you will probably land up in the right place from the physical and the mental symptoms coming together. Then we have a symptom in fever, which is ravenous hungers for days before the attack. So before the fever starts, there will be lot of hunger. This needs to be probed when the patient lands up with fever in your clinic. In skin, we have eczema, which is yellow acrid moisture which oozes under the crusts. New vesicles form from contact of exudation. Now the beautiful aspect of skin eruptions of staphysagria is that the scratching shifts from one place to another. So many times you will be able to confirm, and it's a very small rubric in the repertory as well, and in the materia medica we will have very few remedies mentioned. So when the patient tells you about some skin problems which are there, and we are trying to make our own list of questions to grill them, you can probably also ask about whether the itching remains in the same place or keeps on changing places. And if they tell you that once I scratch here it is okay, but then it starts over here, there is no feeling over here after scratching, like the burning in sulfur or feeling good in sulfur with the burning, or more about other remedies, but it starts over here, then it starts over here, then it starts over here in different places. Then staph is a very good remedy again for fig warts, dry, pedunculated, cauliflower like after abuse of mercury. Other remedies being nitric acid, sabina and thuja. Aggravation for staphysagria in Allen's keynotes is mental affections from anger, indignation, grief, mortification, loss of fluids, tobacco, onanism, sexual excesses from touch on the affected parts. And in comparison, we see the remedies causticum, colocynth, ignatia, lyco, pulse, and colocynth and staphysagria are kind of a hand in glove remedies. One follows the other well. It can be either before, either after. And if you have given the remedy causticum to someone, try to follow up or see if the patient is not getting better and there is an area of improvement still left. Think about colocynth and staph as well. In this cycle, it will cure a lot of cases. It's one of the series of cycle of remedies like sulfur, calcarea and lyco. Okay. Ranunculus bulbosus has a very similar action, so it is inimical before and after it. Next, we study a remedy which is similar to staph, and the remedy is colocynth. So let's open colocynth from Allen's keynotes, and it's a very small remedy in Allen's keynotes, but in everywhere else it's a very big, broad explained remedy. Ailments from anger with indignation. Now it's a very similar presentation with staph. The other remedy mentioned is chamomilla. Extremely irritable, impatient, becomes angry or offended on being questioned. irritable and throws things out of hands. Now you almost get the feel of Staph aureus, but how will you differentiate the sphere of action and the physical generals? There will not be a guilty look over here. There will be more of a look direct in the eye, but irritability. So you will feel the need to almost give the patient Nux vomica, but if the sphere of action and the problem areas are different, think about Colocin. Vertigo when turning the head quickly, especially to the left side, or as if he would fall from stimulants, and also vertigo from stimulants. Then in GIT, one of the very strong areas, we all know Colocin acts over here. Agonizing pain in abdomen causing patient to bend double with restlessness, twisting and turning to obtain relief better by heart pressure. If the patient is also better by heat and heart pressure, think of McFOS. Otherwise, Colocin will do its job. Many patients who have renal calculi, they will need this remedy. Pains are worse after eating or drinking, and they compel the patient to bend double. Like McFOS, if they compel the patient to stretch, then the remedy is Dioscorea. Colic, vomiting and dysentery. Now, one of the most underused areas of Colocin's work of action is sciatica. So there will be crampy pain in the hip as if screwed through the vise. I have never encountered any patient telling me like this, but there will be left-sided sciatica pain, and there is a shooting type of pain which is sudden and unbearable, lightning shocks like, and it is down the whole limb from the left hip, left thigh and left knee into the popliteal fossa. Menses are suppressed by chagrin, colic, pains. And aggravation, we have similar aggravation to that of Staph, which is anger and indignation, mortification caused by offense, and cheese aggravates the colic. Amelioration we have for Staph aureus for Colocin from doubling up and heart pressure. Now I was talking about Merck sol a few minutes ago in Staph aureus for tenesmus. In Colocin you can compare Merck in dysentery with great tenesmus, and then in sciatica you can compare it with gnaphilium, which probably works on the right side and also has more of numbness than just the pain. In Colocin there will be just pain, no numbness as such, and you can compare it with Staph aureus in cases of PCOD, ovarian neuralgias, and bad effects of anger, reserved indignation and silent grief. So that brings us to the end of day 20 with two remedies, which is Staph and Colocin. So suppose you have a case whom you have given Staph aureus, think of giving Colocin to complete the action, or maybe causticum after that, or follow the remedies in a cyclical manner just like you do for the polycrest remedies, sulfur, lyco, sulfur, calcare and lyco. And we see again tomorrow. We meet you all for day 21 of Island's keynote study streak, and the remedies will be announced in my WhatsApp community. So if you wish to join, drop us a message or DM us, and we will connect you with you and take you in the community where we will be starting a discussion on various aspects of different cases, how you can prescribe, repetition, rubrics and much more.